Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Blaine Higgs, Premier ministre. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Good afternoon. Bonjour à toutes et à tous. Au cours des 10 derniers mois, nous avons réussi à ralentir la propagation du virus responsable pour le COVID-19 dans l'ensemble de la province. Nous avons connu succès car nous avons agi rapidement et de manière décisive. Nous avons pris les mesures nécessaires pour freiner une crise avant qu'elle ne devienne ingérable. Over the last 10 months, we have had some success in slowing the spread of COVID-19 virus across our province, and we have succeeded because we have acted swiftly and decisively. We have acted to head off a crisis before it becomes completely unmanageable. We haven't waited, as some other jurisdictions have done, until critical levels have been breached. We have moved to cut off transmission of the virus before it can get out of hand, and that is what we are doing today. La croissance rapide du nombre de cas de COVID-19 dans le sud et l'ouest de la province ce mois-ci est extrêmement inquiétante. Il est impossible d'ignorer la menace que cette situation représente pour notre système de soins de santé et le bien-être des citoyens du Nouveau-Brunswick. Par conséquent, Santé publique a recommandé au cabinet aujourd'hui que les zones 1, 2 et 3 régressent à la phase d'alerte rouge à compter de minuit ce soir. La zone 4, où le nombre de cas a considérablement augmenté au cours de la dernière semaine, demeure à la phase d'alerte rouge. Les zones 5, 6 et 7 demeureront à la phase d'alerte orange. Les changements annoncés aujourd'hui signifient que plus de la moitié de la province se retrouvera en phase d'alerte rouge, soit de Clare à Haut-Lac. Les plus grosses villes de la province et certains des plus importants employeurs du Nouveau-Brunswick se trouvent dans ces zones. La majorité des Néo-Brunswickois vivent et travaillent dans ces zones. La décision de formuler cette recommandation n'a pas été prise à la légère. Je sais fort bien que cette décision aura des conséquences tant voulues qu'involontaires. Il n'y a aucun doute que ces restrictions causeront des inquiétudes et des difficultés à bon nombre de citoyens. Ces mesures sont toutefois absolument nécessaires si nous voulons éviter une avalanche de cas comme celle que vivent les gens de l'autre côté de nos frontières. J'annonce aujourd'hui qu'il y a 31 nouveaux cas de COVID-19 au Nouveau-Brunswick et ils se répartissent comme suit. Il y a 4 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a 3 nouveaux cas. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a 1 nouveau cas. Il y a 21 nouveaux cas dans la zone 4, soit la région d'Edmundston et de Grand-Sault. Il y a un nouveau cas dans la zone 5, soit la région de Hamilton-Restigouche. Il y a un nouveau cas dans la zone 6, soit la région de Bathurst et la péninsule acadienne. Il y a présentement 316 cas actifs de COVID-19 au Nouveau-Brunswick, dont une personne qui est hospitalisée après avoir contracté le virus. J'ai également le regret d'annoncer un autre décès attribuable à la COVID-19. Cette maladie est à l'origine de 13 décès dans la province depuis le début de la pandémie. The rapid growth in COVID-19 cases across southern and western New Brunswick during this month is alarming. The threat it poses to our healthcare system and the well-being of our citizens cannot be ignored. Therefore, Public Health has today recommended to Cabinet that Zones 1, 2, and 3 move to the red alert level. Zone 4, where there has been a significant spike in cases over the last week, will remain at the red alert level. Zones 5, 6, and 7 will remain at the orange level. With the changes announced today, more than half of our province, from Clare to Olac, will be under red alert level restrictions. These zones include our 3 largest cities and many of our largest employers. These zones are where the majority of New Brunswickers live and work. This recommendation is not made lightly. I know there will be consequences, both intended and unintended. These restrictions will undoubtedly cause concern and hardship for many New Brunswickers. But these actions are absolutely necessary if we are to avoid the avalanche of cases being experienced just beyond our borders. Today, there are 31 new confirmed cases of COVID-19 in New Brunswick, and they are as follows. In Zone 1, which is Moncton and southeastern New Brunswick, there are 4 new cases. In Zone 2, which is St. John, Kings, and Charlotte counties, there are 3 new cases. In Zone 3, which is Fredericton and the St. John River Valley, there is 1 new case. In Zone 4, which is the Edmundston Grand Falls region, there are 21 new cases. In Zone 5, which is the Campbellton-Restigouche region, there is 1 new case. In Zone 6, which is the Bathurst and the Acadian Peninsula, there is also 1 new case. There are now 316 active cases of COVID-19 in New Brunswick, including 1 individual who's currently in the hospital. And I must inform you that another death of a COVID-19 patient has been confirmed. An individual aged 80 to 89 passed away at Parkland St. John. This is the 13th death since the pandemic began. And so please join me in offering deep and sincere condolences to the family and friends of this fellow New Brunswicker. There are now 1,953 New Brunswickers in self-isolation, either because they have a confirmed case of COVID-19 or because they have been in close contact with a confirmed case. And I extend my thanks to everyone who is staying isolated and bearing the difficulties that this is creating for themselves and their families. Your actions are helping to slow the spread of infection through the province. Today also marks another grim milestone in our journey through this pandemic. Aujourd'hui, nous franchissons aussi une autre triste étape de cette pandémie dans la province. Nous avons dépassé le cap de 1000 cas confirmés de COVID-19 depuis l'arrivée de la pandémie au Nouveau-Brunswick en mars 2020. En tout, 400 de ces cas ont été signalés au cours des 30 derniers jours. Dans les zones 1, 2 et 3, le nombre de cas est doublé et ensuite doublé à nouveau au cours des 2 dernières semaines. We have now surpassed 1,000 confirmed cases of COVID-19 since the pandemic reached our province in March 2020. 400 of these cases have been reported in the last 30 days. Zones 1, 2, and 3, the number of cases has doubled in these zones and then doubled again over the past 2 weeks. In each of these zones, we have seen at least 3 distinct chains of infection that have spread beyond their original source. And only one of the clusters now being investigated can definitely be linked to an infection that occurred outside of New Brunswick. So we call those unlinked chains of transmission. So we're getting close to calling it community transmission at this point. Many of these cases were spread through large social gatherings, including card parties, celebrations, and holiday gatherings around Christmas and New Year's. But subsequent to the orange phase alert levels, we have still continued to see transmission in workplace settings, in schools, where people have not been wearing masks or where they have gone to places with symptoms and have not been tested. So I do urge you, even if you have mild symptoms, to please get tested. D'autres éclosions ont pris souche dans les lieux de travail où des employés travaillent près de l'un de l'autre sans porter un masque. Ce genre de situation est à l'origine d'un grand nombre d'infections signalées depuis la fin du temps des fêtes. Others started in workplaces where people were in close proximity without wearing masks. This has emerged as a major vector for infection since the end of the holidays. Still others were spread by people who failed to properly self-isolate after returning from out-of-province travel. We do expect to see more travel-related cases. That's not going to go away. I do know that the vast majority of New Brunswickers are heeding public health advice, even when it is not easy or convenient to do so. Your efforts are greatly appreciated. All of those individuals who have self-isolated properly and safely, you are protecting your loved ones, your family members, your colleagues, your community. There remains a minority who are still ignoring restrictions and allowing the virus to spread. It is vital that everyone follow public health direction and advice. It is the surest and fastest way to reverse the trend of spreading infection. But despite all the evidence that decisive action is needed, there will be doubters and skeptics. There will be those who will compare our case numbers with those seen in Ontario, Quebec, Maine, and Alberta, and say we are not as badly off as they are. And to them I say yes, and we don't want to be. There are those who will note that we have only a handful of cases in hospital and declare that our healthcare system is not overwhelmed. And to them I say, not yet. There are those who will point out that we have only seen a dozen deaths from COVID-19 in 10 months. And to them I say, thankfully, yes. How many more would you like to see? And there will be those who will say, is it really that bad? And are these restrictions really necessary? And to them I say, yes, it is that bad, and yes, these restrictions are required. If we don't act now, we will soon see dozens, perhaps even hundreds of new cases every day. That doubling time in each zone will continue to shorten to the point where we will see exponential growth in numbers of cases. We are seeing this right now in Saskatchewan, a province very similar to the size of New Brunswick's. We would see a flood of gravely ill patients that would inundate our hospitals and overwhelm our doctors, nurses, and paramedics. We would see more deaths and disruptions and sorrow. And things can get worse, and they will get worse, without decisive actions, not only by government, but by all New Brunswickers. Please take this situation seriously. Wear a mask when you are out in public and maintain 2 meters of physical distance between yourself and others. Stay at home when you don't feel well and get tested. Stay in your zone and don't travel unnecessarily. Plan your week so you don't have to make multiple trips to the grocery store or for other necessities. Please be aware that the symptoms of COVID-19 can be extremely mild. When these symptoms emerge, please get tested and don't take a chance with the virus. We have come so far and we still have some distance to go. We are actually now probably in the roughest stretch of our journey. I would like to liken it to an obstacle course. We have to get to herd immunity over the next several months while continuing to battle new variants, new travel-related cases, a delay in vaccine delivery. We need to continue to protect our healthcare system and our healthcare workers, not only to provide care in the healthcare system, but to be there to vaccinate our population. We need to continue to protect our most vulnerable, and we need to protect our social determinants of health. And when I say this is an obstacle course, again, these are the things we have to navigate over the next 6 to 9 months. And I do remember when I was in the military, and I was training at basic officer training, and during the obstacle course, we did have to climb a very large rope ladder and then across and then down. And I don't remember how many feet high it was, but it felt very high. And they say you shouldn't look down, but I looked down. And I was halfway across this rope bridge when my platoon mates were standing underneath me cheering for me because I had stopped. I was frozen. I wasn't moving. They were not going to go past the finish line without me included in the whole platoon. And so they stood there and cheered until I kept going, inch by inch by inch, and I got across that rope bridge and down the other side. I don't know how I did it, but I do remember them cheering. We all need to get to the finish line together. We need to wade through these next obstacles together. So we need to be vigilant, we need to be cautious, and we need to be kind. We can and we will get through this. Thank you very much.
Good afternoon. Bonjour. Today we learned that a resident of Lily Court at Parkland St. John's Tucker Hall has passed away as a result of COVID-19. Marsh and I offer our sincere condolences to the loved ones of this individual, and once again reminds me and reminds all of us that COVID-19 is with us, and its outcomes can be extreme. I continue to be disappointed to report that with 31 new cases today, we now have 316 active cases in New Brunswick, almost triple our worst case previously. This is indeed a very serious situation, and we must take a hard position today to address it. We do not want to be in a situation like we've seen our neighbors in Quebec or Ontario or further west. We don't want to be too late in reacting and look back and say only if. Le nombre élevé de cas dans la zone 1, la région de Moncton, dans la zone 2, la région de Saint-Jean, et dans la zone 3, la région de Fredericton, est très préoccupant. Nous sommes dans la phase orange depuis presque 2 semaines, et le nombre de cas dans ces zones de diminuer, pas assuré rapidement. We're simply not making enough progress with the current measures that are in place. We know there are more cases in these zones that exist, but have not yet tested positive, and we cannot take the risk of potentially overwhelming our hospitals. What we have seen in Zone 4, we've seen a renewed interest of people to be tested. We've seen a renewed interest of people coming forward and saying, yes, I was contacted, or yes, I do have symptoms, or yes, I do understand there's an issue and I've witnessed it. We need all hands on deck right now. We need people coming forward and taking extra precautions, not saying, oh, I don't think I have a problem. But that is why today in Cabinet, in the All-Party Cabinet Committee of COVID-19, we've accepted the recommendation of Public Health to move zones 1, 2, and 3 to the red level as of midnight tonight. This is in an abundance of caution, not to be too late in reacting. And we will continue to strengthen our resolve if we don't get the necessary responses over the coming days. These zones will join Zone 4, the Edmundston region, which moved to the red level yesterday. All other regions of the province will remain in the orange level. As a reminder, under the red alert level, you must stay within your single household bubble. Vous ne pouvez pas manger au restaurant, sous le service, au volant, les mettre à emporter, et la livraison sont autorisées. Gyms, hairdressers, and entertainment centers must all be closed. We are asking you to stay home as much as you possibly can. Avoid interacting with people outside your household bubble, and only go out when you absolutely must. If case numbers do continue to rise, we may have to introduce additional measures beyond the red level to gain control. This would mean going back into a full lockdown like we did in March earlier this year, or last year, excuse me. Closing schools and staying at home at all times, except to buy essential items like groceries. We have never been in a situation like this since the pandemic began. We've never had so many cases. We haven't never been surrounded by such record high numbers of cases to the north and to the west. We do not yet know if new strains of COVID-19 are present in New Brunswick, but they pose an additional real threat. And that's something we must also take into account with the actions that we're taking today. Public Health is currently working to determine exactly what a lockdown would look like if we need to take this additional step. And we'll have more information soon about the measures that will be put in place if moving to the red level is not as effective as it needs to be. Moving additional zones to the red level will have an impact on many businesses. And I want to remind business owners that relief is in place in the form of non-repayable grants from Opportunities New Brunswick. These grants of up to $5,000 will be available for small businesses that have been subject to orange or red alert levels, measures for at least 1 week between October 10, 2020 and March 31st, 2021. Les entreprises devraient pouvoir présenter une demande d'ici le début de février. A complete list of provincial and federal relief measures is available on the ONB website, on onbcanada.ca. As we announced on Sunday, schools will remain open under the red level. Cette décision a été prise en fonction des conseils de la santé publique. Et nous estimons que les mesures strictes qui sont en place permettent aux écoles d'être l'endroit le plus sécuritaire pour les élèves en ce moment. Quand les élèves sont à l'école, ils sont dans un environnement supervisé, avec des protocoles de santé et de sécurité stricts, comme la distanciation physique, le port de masque et le lavage de mains. Students and staff in red level zones must stay home if they have even one symptom of COVID-19. Staff will actively be screened for COVID-19 when they report to work each day. If a positive case of COVID-19 is confirmed at a school in the red level, the school will be closed for a minimum of 3 days to allow for contact tracing. The school would also become a testing site for school staff. I know we're asking a lot of our teachers and school staff, and I want to thank them for stepping up by continuing to make sure our children have access to quality education, even under these stressful circumstances. Présentement, je sais que tout le monde est préoccupé. Personne ne voulait encore de nos zones passe à la phase rouge. Mais c'est arrivé et nous devrons maintenant voir cette situation comme une occasion de contrôler le virus une fois de plus. This is a critical point for New Brunswick. Government can put more and more measures in place, but the reality is they will only work if we all agree to follow them. Everyone has a responsibility to minimize the spread of the virus as much as possible. If a business you know or a small operation has had to close because of our actions today, then we all need to think, what part have we played in that? Because this is not a decision we make easily. It's one that we want to get control before it's too late. We've seen our neighbors across the country that have had a plateau of results, that basically have leveled out for a while. And you know, we've seen the 20 to 30 cases, and that's been consistent since the beginning of the year in the last week or so. But we saw that in other provinces. And then it took off, and they can't get control of it. So we are on that cusp. We don't want it to take off. We want to see them reduce, and reduce they must. We all have a responsibility, so you need to think once again about the role you play and how you can protect someone else, you can protect yourself, and you can pretend like you have the virus whether you have it or not. And what would that mean? Even if you don't feel sick, because we know many people do not have symptoms, but they can be a carrier and they can infect someone else. So act like you have the virus. And stay at home. Keep distances. Don't put yourself in a way that you can harm someone else. This isn't a difficult request, but it's one extremely necessary. And if you are sick, obviously, stay away from others. Don't take chances. Even if you have mild symptoms of COVID-19, get tested and be sure. So a vaccine is available, but we don't have secured supply yet. And even this week, we learned of a reduction in our supply for next week. So the Pfizer vaccine, we will not have any vaccines arrive next week. We still expect to receive enough doses by mid-March to vaccinate 35,325 people. But that's only half of the critical first candidates that we wanted to be vaccinated first. So it's so important that right now, even though a vaccine is on the horizon, we don't have them, and we can't vaccinate to the levels we'd like to. But we're in the same boat in that regard as to our neighbors across the country. So we continue to ask New Brunswickers to be patient and vigilant. Demain, 4 zones seront dans la phase rouge. Nous devons voir cela comme un avertissement. Respectez les règles, portez un masque, maintenez une distance sécuritaire, restez dans la bulle de votre ménage et subissez un test de dépistage, même si vous avez un seul symptôme. I cannot stress enough that we are at a crucial point. We're at a point like we have never been in this pandemic before. We have twice, 3 times as many cases as our peak during the pandemic in the past 10 months. We've seen changes in each zone. We've seen some potential community transmission, as Dr. Russell has referred to in her message today. So this is not business as usual. This is not COVID as usual. This is a turning point for our province. We have been a leader in our country in our ability to work together and turn this pandemic back and to cause the cases to drop and to protect each other. Let's not lose that momentum now. And I certainly believe that a tremendous part of this success to date has been our ability to control our borders, has been our ability to contact trace, has it been our ability to clean and disinfect workplaces, has been the diligence that we became a little complacent over the holidays, or one might say a lot complacent over the holidays, and now we're paying the price. So I guess just like a credit card that you use loosely during the Christmas vacation, and when you're on a buying spree, well, it all comes back to you in January. This is coming back to us, and we're seeing the results of excessive gatherings during the holiday period. And now we're paying the price. Let's get the bill paid off. Let's just cut back on what we typically do so that we can protect each other. And let's make sure that this COVID response right now is effective, so we don't need to go the next step, and the next step in a lockdown for our province. We can do this, but this is an opportunity that we must take. Thank you. Merci.
Thank you, Premier and Dr. Russell. Merci beaucoup, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. We'll now proceed with questions from members of the media. Each reporter will have 1 question. Chaque journaliste aura une question. You have the right to pose your question in the language of your choice. Vous avez le droit de poser votre question dans la langue de votre choix. Please ensure your microphones are placed on mute. Voulez-vous assurer de désactiver le son de vos micros? Andrew Watt, Brunswick News.
My question's to the Premier. Premier, I'd like you to talk to me a little bit more about going into lockdown, exactly what will precipitate that, and are you looking at stepping up enforcement and issuing more fines given these repeated violations that you're seeing?
Yes, in relation to the fines and enforcement, we actually stepped that up a lot over this past several days, and over the weekend in relation to going into red in Zone 4. Those activities will continue in relation to certainly going into red in the other zones. And the point that I reiterate, though, is that, you know, if people think they're getting away with something because they have an opportunity to infect someone else, you know, this is I guess a poor indication of how we feel about each other, because we've got to work on this together. So yes, we'll do all of the enhanced enforcements, but the point is we'll never catch everybody. And if people want to be part of the solution, we really need them right now to do just that. In relation to the lockdown, we are looking at the criteria. What we've done here in keeping the schools open is because when the schools close, then you have parents that don't have a place for their kids to go. You have a situation that we know we got into last year with daycares. So you have a whole different dynamic. And then it's a case of what do we do then? In the case of our, how do we keep people at home, but how do you keep the economy moving and people employed and all of the impacts? We have tried to work through this and minimize the impact on the daily routines as much as possible. But we will lock down. And we are looking at the criteria that you can just go back to last spring, and you can go back to when we didn't know where this was going to go, and we shut down early, and we shut down hard. You can look at across the country and what other provinces are doing, but after the fact, and it, in many cases, it's too late. We're not going to wait till it's too late. So we are defining, you know, what a lockdown looks like this week, and if we don't see immediate results over these coming days, then certainly we won't be afraid to make the next step by the end of the week if necessary.
Thank Thank you, Mr. Waugh. Thank you, Premier. Harry Forrestal, CBC.
Thank you, Bruce. This is a question for Dr. Russell. Dr. Russell, can you explain the point at which, over the weekend, you realized that, in your words, it would be safer to keep schools open in red phase areas, which pretty well contradicted months of agreed strategy that such schools would be closed under a red phase? And can you explain your argument that students are safer in school than they are at home?
Thanks for the question, Harry. Well, first of all, we know from the first lockdown, the red phase in the early days of the pandemic, that there was a terrible impact on children's mental health at that time. We also know that the lack of education harmed them, and we do know that as an environment in terms of safety, security, emotional well-being, and even physical well-being in terms of sports and activities, and even food. I mean, there are some children who participate in food programs, and they need to be there. So it's critical that parents continue to work, and for families with respect to income, it's really, really important even for children's development as well, and their academic achievement and their health outcomes. So we wanted to make sure that we were not going to affect their ability to, parents' ability to or children's ability to consistently access healthy foods and safe transportation and housing. And when students are at school, they are in a supervised environment with strict health and safety protocols in place that have been worked out with EECD and public health together. Their social needs can be met while maintaining the physical distancing and using masks and being encouraged to maintain proper hygiene. We did hear from people in the zones that we went to visit around what their views for their children and students in their zones were. And in terms of, again, the public health approach has always been to make sure that whatever risks you're trying to mitigate, that they're targeted and that they're measured and that they're balanced against whatever hardships are going to come from those measures. So that was all taken into account when we went to Cabinet and had those discussions.
Thank you, Mr. Forrestal. Thank you, Dr. Hadil Ibrahim, CBC.
Thank you. This question is for Premier Higgs. What will a red phase mean for workers moving back and forth from Quebec or Maine to New Brunswick for work such as the workers at the chicken plant in Edmundston? Are you considering further tightening border rules to exclude workers like that in all zones?
As part of the process we're going through right now in the next phase for certain lockdown, but it's analyzing the essential workers that are moving across the border, that have been moving, I must say, throughout. But going to the absolute necessity of that move. So if we have healthcare workers coming, into the border hospitals, and certainly there's a need to maintain that capability in the healthcare field. If there's essential services that are being used from coming across the border, it's how many times do you activate or actually seek these essential services? Is a family going to shop for groceries, or can it be one person, or going to the drugstore, or an appointment? It's like looking and scrutinize very closely what is really essential. Part of the problem to date, I would say, is that many people define their own terms for essential, and I think we're going to have to wade in there to help make some of those decisions, because essential has to be, how critical is it that I attend or go to this function? If I don't go, what is the repercussion? And I know, if I use an example, I would say that, we've seen our emergency rooms, the utilization is way down. So I'd like to think that people are making decisions and not afraid to come to the hospital, and maybe before they were coming when it wasn't absolutely essential. But what we do know is that the utilization of the ERs is way down, and people are making decisions that I don't need to go right now. So let's look at that right across the spectrum.
So far, no changes planned in red, but could be more changes regarding that in the further lockdown?
Yes, it certainly could, but I got to reinforce the fact that we're going to be raising the awareness at the borders and the scrutiny at the borders of are these functions absolutely essential.
Thank you, Ms. Ibrahim. Thank you, Premier. Tom Bateman, Brunswick News.
Good afternoon. For Dr. Russell, I'm wondering, have there been any known instances of transmission of COVID-19 in places that are now closed in the red level zones? You know, for example, barber shops, movie theaters, dining rooms of restaurants and that sort of thing. Do we know for sure there has been transmission in these areas?
My understanding in Zone 7 that there are many establishments that closed voluntarily. In terms of a list of places that are closed because of COVID, I don't have a list like that. And I can ask Bruce if it does exist. But sorry, did I say, what zone did I say? Did I say a different, Zone 7?
You said Zone 7. Yeah.
Sorry, I meant Zone 4. I meant Zone 4, sorry. So in Zone 4, there are some establishments that chose to close voluntarily, but if there are some that are closed as a result of a public health order, I don't have that list in front of me. I can find out from Bruce if he can get that for you, if that exists.
Thank you, Mr.
Yeah,
Baker.
my question was, can I just clarify quickly? My question was around whether we know that there has been transmission in the areas that are now closed in red zones. You know, is this something that we're seeing?
Well, I guess in the Nadeau poultry plant, we're doing mass testing of all of the staff there today, actually. And my understanding is they are closed until Friday, again, to make sure that they're doing all the cleaning and disinfecting and contact tracing and testing that they need to. So that's the only one that I'm aware of.
Thank you, Laura Lau, CTV.
Hi, this question would be for Dr. Russell. I'm wondering how many, if any, of these new cases reported in the Edmundston region are connected to the poultry plant?
I don't have the breakdown of the poultry plant today. I'll see if I can get it. I guess it's 17 cases today from Nadeau. To date, sorry, to date.
Thank you, Ms. Lau. Marie Sutherland, CBC.
Hi, my question is for Dr. Russell. The vaccine rollout is underway for frontline workers in New Brunswick. I'm just wondering if you can provide numbers or even percentages of how many healthcare workers were offered the vaccine and declined, and what would be some of the reasons for declining.
I don't have exact numbers in front of me today. I can find out if they're available. I think if anybody has declined, it would be in relation to if they had immune disorders or if they were pregnant or breastfeeding, and they probably wanted more information around the risks around those types of conditions and situations. So I know we have been working with some organizations in New Brunswick to clarify all of the risks around those populations and bring clarity to those types of situations.
Thank you, Alexander Silberman, CBC.
Thank you. This question is for Premier Higgs. How well do you believe information on COVID-19 is reaching young people in New Brunswick?
When you look at the demographics of the current infections, you know, I guess and you look at what they saw in Nova Scotia around prior to the holiday season, and then what we have seen in terms of age demographics, I would say that generally there lies one of the significant concerns. There is this kind of belief, I guess, it doesn't affect, we can still party on, and it doesn't affect me, so I'm okay. And that lies the challenge. So when we've had cases where individuals have come home to isolate with their parents, and their parents, one of their parents, you know, did not live because they got COVID. So we've had cases like this. It's very concerning. And so it is a concern, and it isn't like that we can ignore the fact that even though you may be asymptomatic, you may not be a high-risk population, you are high risk to somebody else. And that's a message we keep trying to put across, but it has been challenging.
Thank you, Mr. Silberman. Thank you, Premier Adam Harris, Brunswick News.
Thanks, Bruce. Premier, you noted that the federal government announced today that Pfizer will not ship any doses to Canada next week, and there will be a reduction in anticipated dose shipments for several weeks after that. You touched a little on this, but I wanted to know what the impact is going to be to your plan to vaccinate long-term care residents this week, And if the goal of vaccinating care residents and healthcare workers by the end of March now won't happen?
Well, we're still focused by the end of March, but I guess what it puts into question is the reliability of the supply. And that has always been the question, is can we count on the supply reliability? And it also means how we have to hold vaccines, in reserve to get the second dosage. I think that what we need to understand is, in relation to the vaccines that have been approved, only 2 have been approved by Health Canada now, and they were approved relatively quickly. So what is the status of at least 2 other ones that are in front of Health Canada for approval? What is the timeline? We can't seem to get any answers on that. And that can help alleviate a lot of the concern, because not only do we have this issue here in New Brunswick, but all of Canada is not going to get any Pfizer vaccines over the coming week. So it is a situation we're all in together, but there are some things that should be answered in relation to approval of new vaccines, and then consistency. We need to know what the numbers are. We'll work with the numbers we have, but we need to have assurance that those numbers are correct. This issue this week kind of gives us some concern in that regard.
Thank you, Mr. Hirsch. John Fredericton, Radio-Canada.
Oui, bonjour. Il y a 21 nouveaux cas aujourd'hui dans le nord-ouest du Nouveau-Brunswick. Il y en a eu seulement 2 hier. Qu'est-ce qu'on sait sur ces nouveaux cas? Est-ce que c'est lié à une entreprise, des écoles, des rassemblements? Est-ce que ces cas sont liés les uns aux autres? J'aimerais juste avoir un portrait de ce qu'on apprend aujourd'hui pour la zone 4.
Alors aujourd'hui, on a 21 cas dans la zone 4 et toutes les informations sur les contacts étroits et la manière qu'ils ont contracté le COVID-19, c'est sous une enquête à ce moment-ci. Et on aura plus d'informations demain. Ça prend vraiment 24 heures avant qu'on aura toutes les informations. Si c'était un contact étroit d'un cas, puis c'était quelqu'un qui isolait à la maison, bien, ça c'est quelque chose que c'est surprenant. Si c'est quelqu'un qu'on n'avait pas prévu tester positif, ça c'est un peu plus difficile, un peu plus concernant. Si c'était quelqu'un qui avait été testé positif dans les dépistages pour le plan NADO aussi, ça c'est, on fait le dépistage aujourd'hui pour NADO pour cette population.
Merci, M. Hughes. Merci, Dr. Vicky Hogarth, CHCO TV.
Thanks, Bruce. Premier Higgs, what reason were you given for the delay in the Pfizer vaccine rollout, and why does Canada's supply seem to be more impacted than other countries?
Well, the reason that I was given is in relation to the Pfizer ramping up in their plants. So the U.S. plant is basically been set up to supply the U.S., and I believe the Belgian plant is going to be focused on supplying other countries. And that plant is taking a bit of a timeout in order to get production ramped up a whole lot. So what one might take from that is that they will be able to exceed the supply criteria after they have this quick shutdown. I'd like to think that, but I haven't had any confirmation of that. So at this stage, the only thing we know is what's not coming. And the hope that we'll resume at least what we had following this week.
Thank you, Premier. Thank you, Ms. Hogarth. Ben Burnett.
Thank you, Bruce. I'm wondering about the school closures under the red zone. I know that in Edmundston, for example, a new case would shut the school down for 3 days. I'm wondering about schools that have had confirmed cases over the past few days in the zones that are now moving into red. And if they aren't going to close for 3 days, I'm wondering why that might be.
Well, I'd have to talk to EECD about that, because we just made the decisions recently, so we're still working on what the operational issues around those decisions will be. Certainly in Zone 4, and because they're already in red now, in the red phase of recovery, the protocol around closing the school for 3 days really is around contact tracing, disinfection, and also testing of staff. So that's the new protocol that's being brought in under the red phase of recovery, so that if there is a case affiliated with the school, and again, the contact tracing is very helpful because it can tell us if if the person was contagious when they were at school or not, et cetera. So it does provide good information from a risk assessment perspective, and it gives the school time to operationalize once they do have the number of close contacts that need to self-isolate for 14 days, then they'll know, can they operate the school with that many staff and students self-isolating.
Thank you, Mr. Burnett. John Chillibeck, Brunswick News.
Thank you. Supply issues aside, would you please explain why public health has told private seniors residences, which have elderly populations who have communal spaces such as dining halls, that they will not be prioritized when it comes to vaccinations the same way that long-term care facilities are? And will the province commit to bringing the vaccine to these privately run residences?
So just 2 points to make about that, John. Number one, the prioritization was really done at the national level with 5 organizations contributing to that prioritization list, including the Special Advisory Committee, which is made up of chief medical officers from across the country, the National Advisory Committee, Canadian Immunization Committee as well. And so there are many inputs that had an ethical lens as well as an understanding about the supply issues and the risks for those populations. So at the provincial level, again, we've targeted that population, the long-term care facility residents, adult residential facilities, and healthcare workers and First Nations adults. We do have 8 long-term facilities that are going to be immunized this week. And again, everybody who's not on the list in that first priority group wants to be on that list. But again, we have challenges with supply, which we've known for a very long time, and that is why the prioritization took place the way it did. And again, we will continue to roll out the vaccine as quickly as we can based on those priority groups. And if it did happen that we were to get an approval of another vaccine sooner rather than later, and we were able to get supply at larger number of doses, then we can look at changing our timelines around the priority groups in the second quarter, because again, everything that we have coming, it's already been, again, decided that these populations are the highest risk at this point in time. And again, we've worked with social development around the rollout plans for those populations, and as well as our RHAs and EMP and A&B for the healthcare workers.
Thank you, Mr. Chillibeck. Margot Castaner, Aquabari, Radio-Canada.
Would it make sense to bring the clinic to those residences rather than have them move off-site?
Margot Castaner, Aquabari, Radio-Canada.
Oui, merci. Quels sont les... Je sais que Blaine Higgs, on a parlé un petit peu en anglais, mais j'aimerais avoir la Dr. Russell, s'il vous plaît, en français là-dessus. Quels seraient les déclencheurs pour passer en confinement complet et qu'est-ce que ça voudrait dire?
Alors, les décisions qu'on a prises aujourd'hui, c'était basé sur la phase rouge qui a été décidée dimanche avec le cabinet COVID-19. Et alors, les déclencheurs ont été considérés pour les 3 zones aujourd'hui. Mais on sait que pour vraiment éviter la situation de devenir de plus en plus pire, on veut vraiment éviter les situations avec les problèmes avec les hôpitaux et les soins de santé, des impacts négatifs sur les services de santé. Et aussi, on veut éviter des impacts sur notre campagne d'immunisation et les employés qui vont participer dans cette campagne. Alors, on va avoir une autre réunion jeudi pour décider c'est quoi quelque chose comme un couvre-feu, etc., d'autres déclencheurs et d'autres situations plus sévères pour protéger la population. On va avoir ces discussions jeudi.
Merci. Callum Smith, Global News.
Thanks, Bruce. I'm just wondering, I don't know who this would be best to ask to, but I'm following up on, I believe it was the first question regarding the potential for a lockdown. What triggers specifically, what criteria would be used to make that decision?
The Premier may want to comment on that as well, but we are bringing information to Cabinet on Thursday to have more discussions around that. So I can't really say too much more. I mean, with the red phase that we've seen right now, we've observed changes in Zone 4 already with respect to testing. More people are coming forward who had symptoms that hadn't been coming forward before to get tested. We do hope to see an increase in testing all around the province with respect to that realization and that awareness that even the mildest symptoms can be COVID-19. And the more people that get tested with those mild symptoms, then we will hopefully not miss people who have been presenting to work or other locations with symptoms. It is very concerning because, again, we know that in order to get the outbreaks under control right now and prevent further transmission, that we do have to have everybody's cooperation.
Thank you, Mr. Smith. Inda NTR, huddle today.
Thank you, Bruce. This question is for both Dr. Russell and Premier Higgs, I guess. Restaurants Canada's data recently shows that restaurants in New Brunswick lost $255 million in sales last year. Gyms and beauty salons have told us it will be very hard to survive if another closure happens, and some cafe owners have said that the $5,000 grant is far from enough to help them survive. And Premier Higgs, you said a few days ago that most businesses are strictly following guidelines. So I'm wondering, what is the consideration for closures of some businesses that have been following health guidelines strictly, while big box stores and retailers can remain open in the red phase? Thank you.
So I know there's sensitivities in what can stay open and what can't. Certainly grocery stores and looking at the facilities and the operations that supply groceries, that's important. The supply stores for home equipment was hardware and things of this nature was basically to ensure that the households could continue to be able to maintain or get necessary supplies in that regard. I would say that if we go the next step into a further lockdown, then it becomes more restrictive into what exactly is needed inside of these facilities, and you make sure that is the purpose, in and out, and not general shopping in a say a multi-purpose facility or store. The issue around the losses of individual business owners, and I very much sympathize with this situation and what it means to them. But the point we're trying to do here is not get into a month lockdown, not get into a situation where it goes on and on. We've been very successful here to date, and we were able, not since March, to maintain the yellow and orange here and there, and basically keep businesses open to some degree, to the point where we even put on incentives for people to travel in our province and to see New Brunswick again. So we want to get to that point, but we want to do it quickly. And so we can try to hang on and just keep businesses barely ticking over, or we can say, let's hit this hard. Maybe we can be down for a week or 2 weeks and be back up to a yellow or back to an orange. But, trying to hang on and not knowing which way you're going to fall is not a risk we're prepared to take. We only have one way to go in terms of the health issue, and that is to reduce the cases and to get us back into a zone that is safe for us to function within our province. The quicker we can do that, the better the businesses will like it, and the safer our province will be.
Thank you. Clara Pasika, Times and Transcript.
Good afternoon. My question is for Dr. Jennifer Russell. I'm calling from Zone 1, and in our community, there's a small village who is concerned that residents aren't recognizing COVID risk because they're in what's being referred to as Moncton region, and they've expressed to us that they have residents who genuinely don't believe that there's been any cases outside of Moncton. In this press conference, you just said Moncton and Southeast New Brunswick. Is that going to be a term that's going to be officially used in the future? And also, do you think that naming communities, even somewhat broadly, would that not be effective in helping people realize that the virus is in these smaller communities?
With respect to the Zone 1 is a particular area. We do have a map on our GNB website. It does include all of the different communities that are in there. We don't plan to name smaller communities in terms of where there are outbreaks and cases for two reasons. One, by the time we announce a case in a particular area, it probably had, the virus had been circulating probably for about 7 days prior to that. So if people were going to change their behaviors, it's a bit too late by then. That's why we are always saying, please act as if you have COVID or the person you're with has COVID all the time, because by the time we announce a case, it's already been there, already has transmitted. We do have to protect people's confidentiality, and so that's the other reason that we don't go lower than the zone level when we're talking about cases.
Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, virtually every hospital in the province is either over its target capacity rate for the orange level of recovery or very close to it, and this is with only one COVID patient in New Brunswick hospitalized. What can you tell us about the red level occupancy targets? And now that 4 regions are at the red level, how concerning is this?
Well, there are ongoing conversations with the RHAs around that. I think that, again, they've been part of our discussions when it comes to triggers, et cetera. We do have 76 healthcare employees that are out due to COVID-19, for reasons of COVID-19, whether Vitalite or Horizon. And again, we work so closely with them on a daily basis around their capacity, around the risks. You know, we are looking at the ages of the people that are diagnosed with COVID-19 every day and projecting, you know, whether or not they would need hospitalization or not. So as of right now, again, we are in close discussion with the RHAs every single day around their capacity and around any of the changes that we're seeing with increasing numbers on a day-to-day basis. So for right now, you know, I know there are some services that have been impacted by the healthcare workers that can't report for work because of COVID-19, either because they're positive or they are self-isolating. And in terms of capacity, again, I think we want to, we're having those conversations on a daily basis with the RHAs around what the phases are looking like right now based on the cases that we're seeing.
Thank you, Ms. McKinnon. Erica Butler, CHMA, Sackville.
Hi, thanks very much. I think this is for Dr. Russell. So the Premier just said we know there are more cases in these zones, referring to the current red zones. Can people in small towns in these zones expect easier and closer access to testing in the coming week? Do we have the capacity for mobile or pop-up clinics, and will we be doing them?
So we also had conversations with the RHAs around testing, and so there are 2 communities where they're going to add extra testing right now. In terms of capacity, we have had capacity. There's never been a time when we haven't had capacity recently with these outbreaks. I think it is, we do hear from the public that it is problematic in terms of driving to certain locations depending on the distance. So there are 2 communities that we're going to add right now, and we're looking at 2 other communities to help boost people's desire and ease for testing in the coming days.
Thank you, Ms. Butler. Mathieu Roy-Como, l'Acadie Nouvelle.
Il semble y avoir beaucoup moins d'employeurs. Je pense que ma question est pour le Premier ministre Higgs. Il semble y avoir beaucoup moins d'employeurs qu'au début de la pandémie qui permettent à leurs employés de travailler à la maison. Si j'ai bien compris, la fonction publique demande aussi aux fonctionnaires de se présenter au bureau, même en zone rouge. Ne serait-il pas temps d'inciter davantage d'employeurs à permettre le télétravail ou peut-être même à l'inclure dans la déclaration d'urgence pour forcer les employeurs à permettre le télétravail?
Well, certainly we're asking in the red zones for people to stay within their zone, and we're trying to keep people the work-life balance functioning as much as possible, and you know, daycares and schools are all part of that. And so to that point, what we've learned through this process is that, yes, you can come to work safely, but we don't want to be traveling across zones and across borders unless that becomes extremely essential. But also, we're looking at what areas can we reduce for essential services and people coming to work. Companies have to make their own decision. I mean, can their employees in the office, for instance, or some of them, can they work from home? Others in an operational mode that are manufacturing or or you know, in a position like that, they have to be there on the workplace. If we lock down, it becomes a different scenario. It becomes a whole different ballgame where you actually then, it's not a case. It's okay, what's running, what's not running. And then you determine that these people won't be coming to work because this facility is not running. So I'm hoping right now we can keep essential businesses running. And I say essential, it's people coming to work as they would to provide the services that they do, and we do it safely. Companies will make their decision whether they can have more people work from home, and we would encourage that. But generally not be crossing zones unnecessarily and for no real reason.
Merci. Thank you. Voilà la fin de notre mise à jour. Merci beaucoup tout le monde. That concludes today's update. Thank you, everyone.